Hello, you're tuned to Pregnancy, Birth and Beyond, contemporary conversations where stories, science, traditions and new ideas meet. Pregnancy, Birth and Beyond. It's about family, connected parenting, celebrating your amazing body, connection with your community and finding your truth. Our show is coming to you from the studios of Bay FM in Byron Bay and is broadcasting across Australia on the Community Radio Network and globally via our podcast at pbbmedia.org.
You're tuned to Pregnancy, Birth and Beyond, contemporary conversations where stories, science, traditions and new ideas meet. Our show is coming to you from the studios of Bay FM in Byron Bay and is broadcasting across Australia on the Community Radio Network. You can find us on iTunes and Spreaker and wherever else you get your podcasts, and on your favourite, that's it. And also on social media on Facebook and Twitter and Instagram under PBB Media or Pregnancy, Birth and Beyond. So today we're going to be discussing what it means to be a healthcare consumer. So are you a healthcare services consumer? Specifically, have you accessed any form of maternity healthcare services in the last few years? As we are discussing how we can improve our maternity healthcare services. So last Friday, Sally Cusack and I spent the day up at Tweed Heads attending a consultation workshop as part of the government's plan to develop a national strategic approach to maternity services. The consultation was hosted by the Australian Health Ministers Advisory Council, and the expected outcome of this consultation or of the project is a document to guide national maternity services policy. So along with about 20 other people, we debated and discussed, listened and contributed to the conversation. What should maternity services look like in the future? What are the main frameworks and who are the stakeholders? What's missing from the current system, and how do we go about attaining a system that delivers better outcomes for mothers, their babies, their families, and those that work within these systems on a daily basis? So we were the only two attending wearing a consumer's hat, representing the consumer voice in the conversation. And although there were many consumer accounts taken through surveys and in person at specific interviews, it was important to have consumers as part of the debate and discussion towards creating a better maternity healthcare system in person. So attending were also GPs, midwives, heads of departments of obstetricians and other interested parties, all conveying their side of the soup pot, and also a wonderful facilitator trained in facilitating these kind of mixed groups. And also, as noted by a health services director who didn't have much experience with maternity, there was a lot of passion in the room, more so than in other areas of health. Everyone attending felt strongly about maternity healthcare. So this meeting was part of phase one of creating this strategy. And in this phase, there were a series of 11 meetings occurring all across Australia. There will also be more phases before the National Strategic Approach paper is produced, and there's lots of work to be done. And although Australia has a relatively safe maternity system compared to other countries, it is still stuck in somewhat an archaic system which promotes intervention, which leads to more intervention, and provides less than 8% of women the type of care, continuity of care or continuity of carer, which affords better outcomes for mothers and babies. So how do we get a better maternity system? Our governance system for healthcare is set up in such a way which requires consumers to be involved in the creation of their local healthcare. This is a wonderful thing. The issues we face around this is that hardly anyone is aware of this in terms of consumers, and therefore very few consumers. So a consumer is anyone who accesses any healthcare. So if you go to the doctor or go to the hospital or any healthcare service. So hardly any consumers get involved in the planning and implementation of these systems. And therefore the result is that those that do plan the system often have vested interests that do not necessarily align with the consumer's interests. So it's really important for consumers to be involved in the conversation and have their say. And so I have the beautiful Sally Cusack in the studio with us today, and we're going to talk about all this and more on this episode of Pregnancy, Birth and Beyond. Stay tuned to find out how your voice has an impact on your healthcare services and how that impact can dramatically improve your health outcomes. So you're here with Annalia Tia and Sally Cusack on the Pregnancy, Birth and Beyond show. And I want to just forward a very warm welcome to Sally. Sally is a founding member of our not-for-profit community journalism project, PBB Media, and has been a maternity consumer representative servicing our local Northern New South Wales local health district and beyond for the past 8 years. And in fact, our radio program, Pregnancy, Birth and Beyond, was inspired by her work as a consumer representative. And yeah, Sally's not new to the studio. She's been here for a very long time, for many years. In fact, this show started about 7 years ago, and we have, without fail, attended every single show, every single week for the past 7 years with a big, amazing team across the years, and dedicated to supporting mothers and babies, families and communities in raising healthier families and children. And yes, this project started 7 years ago by Sally at the steps of BFM. And so we're super happy to welcome her in today as a guest on the show. Sally, welcome. Thank you for joining us.
Hello. Hello.
Hello,
It's
Sally.
very strange sitting on the other side of the panel.
I can imagine. Yeah, it's lovely to have you. I'm really excited about this conversation and about interviewing you because the work that you do is incredible and it's very important. I'd love to highlight both how important that work is today, but also your contribution to the community over the past few years has been immeasurable. And just really want to thank you on behalf of us at PBB and the community.
Thank you.
Yeah, so tell us, how did you get into this work? You're a consumer representative, and we'll talk a bit about what that means later, but how did it all start?
Well, quite a usual sort of path, actually, I've since discovered. For my second child's birth, we had a home birth, and this was almost exactly 10 years ago. And shortly after that, I must have been on some kind of mailing list for home birth services, and an email was sent out inviting, really imploring families to be a part of the National Maternity Services review that was happening in 2009, so early 2009, around that sort of time, 2008. And women were invited to make submissions in support of reforming our maternity services. And one of the big things that concerned me was that it could mean that other families couldn't access home birth with a registered, insured private midwife like what we had access to, although she wasn't insured for the actual birth. And that was a problem that had developed in the couple of years prior with insurance policies. But nonetheless, we took on that risk because we wanted to just have a normal birth in our home, just, do a pretty normal thing, really. And it was a huge learning experience for our entire family to see how different a birth can be when the woman is in the centre of all of the decisions. So I learned through that process it's not so much the place of birth that makes the difference. It's the woman being in the centre of her decisions. So you can still have the kind of birth that you feel is the safest and best for your family anywhere. Really it's not the place of birth, and international research supports that it's not the place of birth, it's who her carer is, who is she with. And if she has relationship-based care, she and her baby are more likely to survive the perinatal period. And I didn't have that experience with my first birth. There was no continuity. I experienced the conventional care that 90% of families in our country experience, which is all by very well-trained professionals, but not in any kind of relationship. And that lack of relationship has a massive impact on your ability to make informed decisions. And what other international research has found is that if you're not actively involved in your decisions around your care, you're basically less likely to survive the care. So when I heard that this was under further threat, access to home birth was under further threat, I wanted to get involved, so I wrote a submission, and that's where it all started. And And then in 2010, I got involved there was local actions here through that review process, and then just met amazing people. I've just met such amazing people in the realm of birth. And through that, we put together a team and started our radio show in 2010. In September 2010, we first got together.
In a way, I think a lot of people get into working in relation to maternity services through their own birthing experience. I know a lot of midwives become midwives after they have a baby, or not all of them, of course. A lot of them are passionate about it before they even have babies, but the experience definitely changes, and the point of view changes once you do have your own children and experience birth yourself, and the impact of that and the relevance of that. So it's amazing to see how that led you to kind of go down that pathway of advocating for women. So what happened from there on?
Well, I suppose just going back very slightly to your mention of people having prior experiences that then go on to motivate them to take action, there was just such a stark difference that I experienced between my first two births, and realising that most women experience what I experienced first time round, and how inferior that was to relationship-based care that I paid for second time round and would pay for over and over again. It was just so incredibly different, and simply supported me physiologically for my body to go through the process.
What is a consumer representative? What does that mean? What does it entail?
So the role of a consumer advocate or a consumer representative is someone who ideally they have a bigger picture sort of view, but it does come from their personal experiences, and they represent the views of their community, and speak commonly at local health district meetings and in steering committees and so on, and just make sure that the consumer's view, the health consumer's view, is remembered in the conversations, because most people in the room are health service employees who are all really well-meaning people and want to do the best they can, but you can't wear both hats. You are either working for the health service or you're working for your community. So you represent your community, basically, just reminding, like in the case of, in this region, women were wanting access to publicly funded home births. So I let them know of that, along with many, many other people from my community, just making sure, no, this is what the women are actually really wanting. Here are the petitions, et cetera, et cetera. Yeah.
So what does that involve? Do you speak to lots of women every day on a regular basis? Because I'm also a consumer representative and have been for about 4 years, specifically because you inspired me to do that. I could see that the work that you were doing was very important and had meaning and impact, and it touched the very core of something I truly believe, which is in that freedom for us to have our own choices and have so with safety and care and deep understanding and deep listening to what's going on for our bodies and what's going on outside of our bodies, and being able to navigate that. And it's unique to every woman, and I could see that as well through lots and lots of stories. But for you, what are those things that you do regularly that allow you to be able to then pass this information on? And it's such important information that otherwise just isn't getting there. And also, I'd love to touch on why that information from specifically the maternity consumer themselves, so women and their families, and or other people that are having babies that don't identify as women, but for them, when they're having their children and their babies and going through the system, why specifically these people are not heard? Why is their voice not so strong within? Because I know that that's an issue within maternity services.
Well, okay.
Lots of questions
yeah,
there.
big questions.
Two big questions.
It's a really huge area. And for me personally, going back to your first question about what's involved, I went on a huge personal journey of research, and going along to meetings and gatherings that were happening in the region at the time around these reforms that were happening around 2008, 2009. And just sort of learning about the landscape, because it's actually quite a textured landscape with lots of different stakeholders and perspectives and interests that don't always overlap. So I found that really interesting. Like, I stepped into it so naively thinking, doesn't everyone just want mothers and babies to do a little bit better in birth? And everybody does, but everybody has their own way of achieving that.
And their own perspective of what that is.
Yeah.
The idea of what safe means, the idea of what healthy means, the idea of what a good outcome is, which is a big, weighty subject within these conversations. What is a good outcome?
Yeah, it's also subjective, really, but we need to come back to some, basic understandings and what I discovered along the way, but it was just so not apparent, was the basic human right of anyone giving birth to choose where and with whom they give birth, and just really understanding what that means. The other thing is I wanted to look into the research. I kept thinking, so we've got this really great policy and people are saying really good stuff over here at lofty levels of Commonwealth, Senate inquiries and, the drafting of frameworks and so on. Why at our local hospital or the local hospital in Tamworth or Alice Springs or whatever, you find such disparities, such differences, and how does that happen? And so there's research, amazing research from all around the world, and actually a lot of it from here in Australia. We really punch above our weight for amazing evidence-based research around the best way for a mother and baby to survive the perinatal period. But it doesn't end up translating. And I kept wondering, how is it that this research doesn't actually end up in, actually happening beside the person giving birth? And so I just went on this massive research journey. And so that was something that I did. I just kept just asking myself, why? And another, just a little side point because really that's such a massive question and I don't want to take up the whole interview with it, but I did also come to see that I needed some distance from my personal birth experience to be able to speak for other people. And I certainly feel now, at nearly 10 years down the track since I last gave birth, that I do hope that while I have, obviously the shadow of the influence of my experience and the rewiring that happened in my brain as a result of the two different experiences and how they inform me, the emotional charge is out of there now. And I can sit at the table and speak without sort of bursting into tears and, because it is a highly emotive arena. And having a little bit of that distance allows you to be able to speak for others, because not every woman wants to give birth the way I want to give birth, but I want to be able to represent her.
Yeah, that's a very beautiful desire and a very beautiful intention that you have. You're with Analia Tia and Sally Cusack in the studio today on the Pregnancy, Birth and Beyond show. If you'd like to check in with us or share some of your stories as a consumer or somebody that represents consumers in the healthcare services, we'd love to hear from you. We've been talking about what it means to be a consumer representative today and the work that we do here at PBB Media and also in our private lives representing consumers. Both Sally and I are maternity consumer representative, and Sally has, over 8 years of experience doing this work. And we've recently went to a national consultation workshop, which lasted from 10 a.m. to 3 p.m. up at Tweed Heads, working on the national strategic approach to maternity services. And we wanted to have a chat with you about that today, what that is, why it's important, and how you can get involved. So what is going on in the maternity services arena here in Australia, and also specifically in our local health district? of the northern New South Wales?
Well, I'll speak firstly to Australia and then drill down to what's happening locally. So after the review that I mentioned earlier that was happening in 2008, 2009, what happened was the COAG of health ministers around the country agreed to implement a plan called the National Maternity Services Plan, and it was to be a 5-year plan starting from 2010. And this plan was a great plan, actually. It was ambitious but all evidence-based and all about improving outcomes for families in the maternity system. And one of the key, if we were to just sum it up in a few words, what the national plan was about was introducing so-called woman-centred care near where women live. And so what that means is locally provided care, so even for families in remote and rural regions, not closing down little tiny maternity units, but actually keeping them open, and keeping women in the centre of the decisions. And the
Which was different to what has been on offer for the past, a few decades for women in maternity care, isn't it?
Well,
there's quite a big difference between the different models of care that have been and what was being suggested to implement.
In practice, yes, that's the case. I mean, in fact, it was, if you were going through a private midwife, you could totally access that. In fact, it was in your home, and it used to be easier to get. But woman-centred care, like in any other arena of health, if you place the patient in the centre of the decision-making, they are more likely to survive their care. So iatrogenic injury, which is injury caused by the health system, is greatly reduced when the patient is actively engaged in their decisions. In the case of maternity care, the other crucial part to the National Maternity Services Plan was that they wanted the care to be delivered in the so-called wellness paradigm. And that makes it a unique service in health, because everything else is delivered in the sickness paradigm, if that's the term, the opposite to the wellness paradigm.
Yeah.
So
that basically means that a woman coming in to give birth, a woman who's pregnant, a woman who's breastfeeding postnatally, that whole perinatal period, the woman is, assumed to be a healthy woman, and if something goes wrong, then she gets care, versus everybody else that's accessing healthcare, something's already gone wrong, and that's why they're coming to access healthcare. And there is a very big difference in terms of...
Well, because that reflects the truth, you see, because
Absolutely,
most women are well when they go into pregnancy. It doesn't pathologise them into this sick situation. Complications do arise in pregnancy. There's no denying that. And that's why our healthcare service is available, so that, basically the recommendation was that carers who are experienced in delivering maternity care in that wellness paradigm, so not assuming that she's sick, end up providing the best, that woman and her baby will have the best outcomes when she has that care, when well networked with emergency or higher level services, if that woman deems necessary. So this is the best way to deliver it. So this is what was required. This is what everyone around the country was meant to have access to this. And by 2015, hooray, we'd all sort of get there. But unfortunately, what's actually happened is that due to the deregulation and decentralisation of government that's been happening over the last 20, 30 years, and happened again at the state level about 5 years ago, these policies just sit up the top there. They are no longer mandatory. So they're only taken on if someone at the right down below the state level, down to the local health district level, or health and hospital service. If you're in Queensland, there are other terms across the country, but your local health service, you have to be lucky enough to have a super keen, super motivated, willing to go against the grain manager who will implement that policy.
Who will push to implement that policy. And even then, that's not necessarily
Well, it's a huge cultural shift and difficult to implement without the word of women. So,
and without KPIs attached as well. So, which is, can you explain that a little bit as well? Because I think that's an important part.
Well, that's part of the deregulation of government. If there are no KPIs, key performance indicators that are attached to any new policy, and no mandatory ruling of the policy, it just won't trickle down. Yeah. And so we get to the end of 2015, and what's happened? Well, virtually nothing's happened. There have been some key in some areas. There have been some health services around the country who've seized these policies and seen them as a great opportunity and have turned their service around much more to being much more women-centred. And the best way, by the way, to deliver women-centred care is to provide continuity of care. And services like Gold Coast Hospital, our local health district here in New South Wales, and other pockets around the country, in Sydney and Melbourne, there are some great services too that provide continuity of care. But what's happened in the same period is that others have shut down.
And also, currently, it is believed there's not, from what we understand and what we've heard also just very recently at the meeting, the data isn't captured correctly, but it is believed that less than 10% of women in Australia are receiving continuity of care from any carer, any type of carer, which basically means that the woman will be seeing the same person or group of people throughout pregnancy, birth, and postnatally to support her throughout that whole process and to improve those outcomes. And so even though there has been some great services implementing some of the 2010 to 2015 plan, there were 5 years to implement it, still right today there's less than 10% of women accessing that type of care, which was what that plan was meant to deliver across Australia. And this was something that was agreed upon, across the board with every single health minister in Australia. And money was put towards implementing it. But then we see this kind of big gap between the actual plan, policies and research and what's going on down at the bottom level for everybody else.
Yeah, so what happened then was that the health minister said, oh yeah, that all sounds like a lovely idea. But in the case of New South Wales, in only 1 or 2 years after that, the New South Wales government deregulated the health services, so their health policies at the New South Wales Health Department level could no longer be made mandatory. So it all just became optional.
Yeah, and unlike New Zealand, for example, which has one government and the government decides one thing and everybody else has to do what they say, the whole country has to do what the government decides. It's very different here in Australia. We've got 7 different governments, another bigger government, which, and it's very complex and complicated, and making decisions and implementing things can be quite complex, but there is hope, and that's where the consumer comes in. And there is policy and laws, in fact, written into how we plan and deliver healthcare that involves the consumer.
Standard 2 it actually came out at the same time as the National Maternity Services Plan as part of a suite of health standards. And those standards were to improve the safety and quality of healthcare across all services in the country. Standard 2 is called Partnering with Consumers. And that policy was implemented in recognition of worldwide health consumer research that's found that you are more likely to survive your healthcare when you are actively involved on a personal level in the decision making, but also when your community is actively involved in the design of the services that you receive.
Because each community is quite different. If you're living in Dubbo or in Byron Bay or in Broome or, in a remote Aboriginal community, where there's no access to lots of different services, your community has certain needs compared to somebody who's in Sydney and there's 5 hospitals within a stone's throw. And so that's why I think that is a great policy and why there is great potential in deregulation and allowing each community to do their own thing. But what's missing and what's, I think, very poorly understood both by the health services and by the community themselves is that we really do require people from the community to step up and say, oh, this is what I want, and this is what I would like, and this is how I see things unfolding. And, you know, how many elderly are in this community and what do they need? How many women are single parents, you know, and what do they need? And it's very different for each community. And I think this is what this conversation is about at the heart, is getting consumers to understand the need for their involvement if they want to have better healthcare services, if they're interested in accessing a service that they would really like that isn't existing at the moment, or they want to improve a service that exists at the moment. And that we really do need your voice as a community to be part of that change.
And if you just want to experience better outcomes for yourself.
I'm Analia Tia and Sally Cusack in the studio with me. This is the Pregnancy, Birth and Beyond show. We're talking about the impact consumers can have in shaping their healthcare services and why that is so important, why and how being involved in shaping your healthcare services can dramatically improve your outcomes. And there's many facets to this, and we're touching really just the tip of the iceberg here today, and the different factors and the different aspects that are involved in shaping healthcare as well, and what's hindering and what's promoting. And specifically today, we're really looking through the keyhole of maternity services, but we'll give you, another example to so you can, understand how it goes across the board. But thank you for staying with us. We believe this is a very important conversation. We'd love to hear from you about this. You can get in touch with us at pbbmedia.org, pbbmedia.org /maternity-advocacy, and also email us on hello@pbbmedia.org. We'd love to hear from you. Sally, I'd love to hear more about why is it so important to advocate for your own health?
As I mentioned earlier, when you are more actively engaged in your own personal health care, you'll achieve better outcomes. And the other thing is the health service will save money as well. Where health services around the world are experiencing rising costs, and in this country they're rising exponentially, and we're seeing also rises in all sorts of non-communicable diseases in our children as well. So as a population, we're getting sicker. So our need for health services is only going to grow. And the issue that really started to, a few years ago, I watched a film called Microbirth, and I was really alarmed to see a professor from the University of Sussex, Stefan Elba, talking about, he's a health economist, and he said that globally health services are close to, in the last dying years of their operation as we know them now. And by 2030, they will be about to collapse. So I want my children to be able to access emergency services when they're parents. And at this rate, the services that we use now, that we are so thankful for now, will not be available. Now, in the field of obstetrics, there's a huge opportunity there for us to not only improve outcomes, but really reduce costs. This field is, the spend is rising exponentially and is now the third biggest spend in any hospital. So when we follow the policies that have been informed by international and domestic research and the World Health Organization, and over decades, it's not just somebody's bright idea on a Sunday afternoon. This has been part of a massive international effort to really try and understand the safest way to bring babies into this world and to have healthy mothers and
healthy
families.
Babies, short and long term.
Yes, yeah. So one such example is the use of caesarean section, which is a vital, life-saving surgery. But it's possible that some women in this country are being over-serviced with that particular service. When you measure our performance with averages across other OECD countries and recommendations by the World Health Organization. So the difficulty with that is that it can mean that when these guidelines aren't followed, women who really need it don't have access to it. So it's about the provision of timely care when medically indicated and provided in a relationship-based situation. Just one sort of other issue underlying all of this, and that prevents all of us from really making big inroads into this, is all of us getting a bit better at assessing risk. All of us getting a little bit better at and a little more confident to just really kind of think, so you're saying I have this level of risk. Can we just apply that to me? Let's just think about that. Can we maybe even look at the study ourselves? So getting a little bit better at that. And, you know, one example just for men about the misinterpretation, the widespread misinterpretation, not just by the general public, but I'm meaning by clinicians, is in the field of prostate cancer testing. There's a PSA test that most men over a certain age in this country have. I've read Risk Savvy. It's a book I really encourage everyone to read Risk Savvy, and in that book that author says that 80% of men over the age of 80 will die with prostate cancer, not from, with prostate cancer. So just sort of, you know, we need to kind of really get better at this, and we do that by helping each other out. So moving very quickly to how you can make a difference. You can be a part of this review that's going on again. So once again, it's a bit like Groundhog Day. We're re-looking at all the same stuff in the National Maternity Services Plan. We've got a link on our website, and you can look at that there to make your submission and have your voice heard. On a personal level, you can look up Choosing Wisely Australia, which has great information on how you can be actively involved in making decisions for your care, because it is big and it's not something we're used to. But basically there's a little acronym, BRAIN, and that stands for benefits. What are the benefits? What are the risks? What are the alternatives? What does my intuition say? And what if we do nothing? So if you have those questions, that will just really improve your outcomes, and always seek continuity of care.
Thank you, Sally. That's incredible. We're nearing the end of our show, and we're going to leave you with all of this information and more on our website. If you have questions, if you want to see the links, if you want to read that book Sally mentioned, Risk Savvy, all of that information is going to be on our website, and we're going to put a link on social media as well. But if you'd like to go there right now, there's some info there straight away for you to get going. It's pbbmedia.org/maternity-advocacy. And yeah, we'd love to hear from you. Shoot us a line, hello@pbbmedia.org. You can catch this podcast on iTunes, Spreaker, and anywhere else you get your podcast. Thank you so much for hanging out with us. Just quickly, some wonderful international news. Ireland has voted to repeal the 8th, and that means they are now able to have or soon they will be able to have abortion legally, which was not the case for the last few decades, and it has caused a lot of trouble for women. And it's a wonderful win for Ireland and the world, because this is happening across the world in various different places. And we just wanted to mention that we're extremely excited about that, and so happy for Ireland and for everybody else. And thank you again for being with us. We hope you've enjoyed this show, Pregnancy, Birth and Beyond, today. And we'll see you next week for more information and inspiration.
We hope you've enjoyed this episode of Pregnancy, Birth and Beyond. Tune in next week for more information and inspiration, bringing us full circle. You can find our show on iTunes, Spreaker, the usual social media under Pregnancy, Birth and Beyond, and our website at pbbmedia.org.